Hi guys, welcome back to my channel. My name is Khadijat Adeshola, and in my channel I'll talk about everything related to women and midwifery. So today I'm going to be talking about midwifery preceptorship program, all you need to know about it. So if you are a midwife currently looking forward to migrating to another country, to UK, or you're already in the UK, you currently pass the OSCE and you don't really know what your program is for the next 1 year or 6 months, or what is the next thing for you to do, or you are a midwife in the UK, you train in the UK and you recently qualify as a midwife, then this video is for you. So if this video looks like what you're looking for, stick around, wait to watch till the end. And if you like the video, don't forget to subscribe to my channel, because I'm going to be putting lots of information regarding this, related to this, in my channel as well. And don't forget to share to your friends and colleagues who may benefit from this video as well. So if you are my returning subscriber, thank you so much. Like, I really appreciate this. Thank you. And don't forget to keep sharing my video if you've been doing that before. If you have not been doing that, please share it, and also comment your opinion or what you think I should have added to this video. You can also comment it on this video. Okay, so back to what I'm going to be talking about, the midwifery preceptorship program, all you need to know. And, or let me just say, you've written what to expect basically when you get to the UK as a midwife from another country. So the first thing is that obviously you have to pass your NMC or ski, and I've put some information about some tips about how to pass your NMC or ski and all of that. So in this video, so if you've not seen that, check my channel. You see something related to the NMC and some NMC station questions that they might give you as a midwife when you go for the NMC or ski. So after you pass your NMC or ski, the next thing they will ask you to do is to work as a, before you may be working as healthcare assistants, maternity care assistants, after getting your before getting your PIN. So this differ from trust to trust. Some trust, immediately you get to the UK, they introduce you to the ward, you start going to the ward, but you keep doing like support workers job, but not the main midwifery job. Why some trust, they train you, they give you all the support you need to pass your OSCE, and after passing your OSCE, then they take you, they send you to the ward. So it differs from one trust to another. So you can either go to the ward straight when you get to the UK, or you are going to the classroom to prepare for your OSCE. So either way, before you start practicing as a midwife, you must get your PIN. Now, during the period when they will send you to the ward that you've not gotten your PIN, you'll be sent to all the ward in the maternity department, and the wards in the maternity department includes triage. That's where the just like the O&G, like the emergency department basically. So that's like the triage. That is when women come, they like assess them, where they need to go, do they need to be admitted, and all of that. And also they have the delivery suite, that's labor room, they call it delivery suite. Yeah, basically. So I don't know, SUITE. So if you can pronounce this better, basically. So delivery suite, then they have the antenatal ward, they have the antenatal day assessment unit, they have the early pregnancy unit, they have the postnatal ward, and they also have the community. So those are the departments under the maternity. So you will be expected to go all of that. Some department or some hospitals, some trusts can also send you to the gynae ward as well, because midwives are also in the gynae ward as well. Some midwives, some trusts will have the high high dependency units for the midwifery department as well. Then they will have the ICU as well. They have theater. Of course, there's theater. So you will be, sent to all of those departments when you have passed your OSCE. And this period, you've not started your preceptorship that time as an international midwife. You are like a pre-registrant practitioner, that you've not been registered but you've passed your OSCE, so you will work as that person, and you'll be expected to work through all the old departments. So minimum of like 2 days, some might be weeks, but basically 2 days or one day in those departments, so you get to familiarize yourself with what they do there. You're basically not really doing things much, because it is quote unquote you're not a registered midwife yet until you get your pin. So now, after getting your pin, the next thing they will ask you to do to work as is to work as a preceptorship midwife, like to start your preceptorship program. So depending on the trust, the months or that you will spend as a preceptorship midwife differ from one trust to another. So, and it is like minimum of 1 6 months to one, it's between 6 months to 1 year in trust, in different trusts. So that is how it looks like. Then during this program, they will give you, booklets to sign, midwifery competency booklets to sign. So depending on the trust that you have as well, different trusts have different places, like section for all the departments, all the maternity department. Like they have section you need to sign for when you go to delivery suite placement. They have section you sign when you go to triad. They have section you sign when you go to postnatal ward. They have section you sign when you go to antenatal ward. But in some trusts, they put everything together. So whenever you think you're competent in that aspect, you just sign it. So during this period, you will be placed to, you will be sent to different departments as well, different wards, or all the old wards again. But this time around, you will be going there as a midwife. Then now, for the very first period, like for the first 2 to 6 weeks, so it differ from trust to trust and also from person to person. This period, you will be working as a supernumerary professional, supernumerary midwife, basically. So in this period, you will be on the roster, but you will not be working alone. You will be working along an experienced midwife or a senior midwife, and you'll be working under that person's pin, basically. So anything you do, that person is responsible for you at that shift. So you need to work along that person. If you have any questions, you ask that person. If you are not confident in doing anything you're supposed to do, that person will do it for you within that period. So within that period, you are basically just seeing what they are doing, know how they do this and all of that. Then you are doing this supernumerary period at every ward that you go, even after getting your pin and after working 4 months or 3 months in one ward. Once you go to another ward again, you will still do that supernumerary period, because this is obviously a new place. You don't know what they're doing there and how they do it, because different wards have their own way of doing things. So you will basically be doing this supernumerary period as soon as you get to a new ward. I hope you understand that. So for instance, now you've gotten your pin and you are now starting your preceptorship program, your supernumerary program, or so you are starting your preceptorship program. So once they send you to a particular ward, you will first of all work as a supernumerary midwife. The supernumerary midwife means you are not alone. you will be supported. You will not be counted like quote and unquote as a midwife in on the sheet for that day. So because you are working along with somebody, you are just like a support person. But during this period, you are more involved. You will do a lot of things. You will be doing a lot of things, unlike when you are a pre-registered practitioner that you cannot do anything midwife does because you are not registered here yet. So this period you will do everything that midwife does as well. But anything you don't know how to do, anything you cannot do, anything you are not confident in doing, you will tell that senior midwife to put you through, to watch you while you do it and all of that. And at this period, you will assess yourself if you are competent enough to start working alone. When you're working alone as well, they are still going to support you, but you are, responsible for yourself. You are accountable to your own action. And one thing I like this place for is you are being left to assess yourself, unlike somebody assessing you. So you need to assess yourself. You need to be honest with yourself. Am I confident enough to do this? So the moment you say that, okay, yes, I cannot do this alone, then they start putting you on the shift. Like, when you're on duty now, you're working alone. So you'll be responsible for in the care of significant number of ladies, depending on the shifts that you, or depending on the ward that you have. So in the delivery suite, they are trying as much as possible to have one woman to one midwife in labor. So if you have women that is in labor, if you're working in the delivery suite, you're most likely going to be like you alone to these women. So at that period, you must be like competent enough to identify emergencies, to be able to escalate emergencies, and to be able to ensure that this woman have the best support during the delivery process, during the labor. So you have to be sure that yes, I can do this before you tell them that okay, I am okay now to go alone. So they will keep assessing you. You will have a manager, you have someone that you report to at every point in time. So you need to be able to assess yourself and to be honest with yourself if you can go alone. If you are not ready to work alone, you can still tell your manager that can I have two more weeks as a supernumerary midwife before I'm being left alone. If you are okay after 2 weeks, then you can now tell them that I'm competent enough now, I'm confident in myself to work alone. So that is how it is. So when you are now working alone, you'll be expected to sign a lot of things as a preceptor, as a preceptorship midwife. And don't forget, the moment you have your PIN, you're already a band 5. Yeah. The moment you have your PIN, you are band 5. So whether you are doing supernumerary or you are working alone, it doesn't really matter regarding your pay. So you still get pay as a band 5 midwife. The only thing that you cannot do is that you cannot take extra shifts that you want to do extra shift, because you are not working alone yet and they still attach you to a midwife. So you won't be able to do that working as a supernumerary midwife. But once you are, working as a supernumerary midwife in that ward, basically. So if you have had your rotation to delivery suite and you are now in postnatal ward as a supernumerary midwife, you can take extra shift in delivery suite, basically, because you've been there before, you've been working alone before in that place. I hope you understand what the discussion, how it's like and all of that. So I'm going to do another video of how it is like working in different world, basically. So this is just the general thing about the preceptorship program. So within that 6 to 1 year, you'll be expected to have gone through significant department and have spent 2 to 3 months in each of those departments. Now, it also depends on the role or the appointment or the contract that you sign with your trust. So this is for people that sign the document that they can be rotated to other department and all of that. So most midwifery job posts are usually rotational, especially for us coming as an international midwife. So once you are now more specialized, that you have worked with the trust for a couple of years and you are now specialized in particular department, that is when they might not be rotating you again. But before that, you will be rotated to different department, and that is the reason why they ask you to do the preceptorship program and to go to every other ward, in case they will be needing to there will be need for you to be rotated to that department. So basically, that is the how it looks like, how the preceptorship program is. But during this period, you basically sign lots of things, and you've been left alone to sign it when you feel you are confident enough or you are competent in that skills. So there are lots of skills here, basically just the skills that we know about, but because they've got like lots of equipment that we don't have in our country, so they have lot of skills for you, additional skills for you that you need to sign when you feel you are competent, like using the CTG. When you feel you're competent enough to use the CTG, to interpret the CTG all alone. So when you are managing a lady and you put the lady, you know when to put the lady on CTG, you know when to take the lady out of CTG, you know when you are having an abdominal CTG, you know how to call the doctor, how to bleep the doctor and all of that. So all these skills, you need to sign it when you feel you're competent enough to do that. And also during that supernumerary period, you will be able you will not be placed alone until you are confident in yourself that you can identify emergencies, and you can initiate the actions needed in case of an emergency. You can rightly escalate to the right person. You can call the doctor when need be. You can call the senior midwife attention to an abnormal CTG, and you can basically do all of the things that is expected of you in that ward alone. You basically know where different things are kept in that ward. So those are the things that will be expected of you, to be able to say, okay, yes, I can now work alone. I'm okay with this 2 weeks supernumerary period, or I need extra 2 weeks supernumerary period. So if you need it, talk to them, talk to your line manager, talk to your supervisor, talk to them that you cannot stand alone yet. So that you need more weeks to be able to, to be sure that you are okay to work in that space. Now, you can also talk to them if you need any extra support. Nobody knows it all, and there are really 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 lots of things to be done in the world. So if you are concerned about anybody, any lady, make sure you tell the senior midwife, you tell them again if they forget. And also, if you yourself you forget to do anything, the moment you remember, do the right thing, be honest with it that you actually forget. Another skill that is actually important again is administering IV medication. They take it very, 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 very serious. So you have to be sure that you know how the dilution process here, how it is done. You assess your trust policies, guidelines in everything. You read your trust guidelines in everything, especially things that are peculiar to that word that you have. So you need to be able to be confident in yourself that yes, I can do this, yes, I'm competent in this, before you will be left alone. And once you are left alone, you are now accountable to your actions, you are now accountable to the ladies. For instance, if you're working like in antenatal ward now, you may be responsible to take care of like 8 ladies, 6 ladies, 10 ladies, depending on your trust and how well staffed they are in that place. So sometimes you may be well staffed, you may not be well staffed, so you might have like to take care of 8 ladies in the postnatal ward, or 6 ladies in the postnatal ward or antenatal ward. But if it's in the delivery suite, they actually try as much as possible to have one midwife with a woman in labor. But if you are in the antenatal ward as well, but you have postnatal patients, like the one that just have an SVD and all of that, you may be taking care of like 2 3 ladies, because obviously you are not doing much things. So it depends on your trust, but the most common thing is that the preceptorship program is just a kind of program to support you. It's a program that is being, the preceptorship program is a period, let me just put it that way, is a period where you will be supported until you are competent enough, or you are like quote and unquote a senior midwife. Basically, you move from band 5 to band 6. In some trusts, before 1 year, like in 6 months, you will be moved to band 6. Once you are, you demonstrate competency in most of the things that you're expected to, and you sign a lot of, your documents, your book that they gave it to you, you sign significant percent of it. So you might still be on your preceptorship program, but you might have, be moved to band 6, but you are still doing your preceptorship program. So the maximum time to complete the preceptorship program is 1 year. So, but in some trusts, you will not be moved to band 6 until you finish that preceptorship program. You have signed your book, you are competent in most of the things that is being listed in the book that is being handed over to you. So you will definitely need to sign books during that preceptorship program period. And one thing here is that if you can't do it, nobody will sign it for you. So basically, they will watch you doing it, and they would like, okay, sign you off that yes, I can see that this person is that competent in doing this, competent in doing that. And at times you've been left to sign yourself off. So you will sign yourself when you think that yes, I'm okay with this, yeah, I can do this alone now. So basically for me, I'm just starting my preceptor no, I'm not starting my preceptorship program. Yes, I'm still doing supernumerary in my ward. So I've just been posted to postnatal ward, antenatal ward, and that is my own first place of placement. So I'm still doing my supernumerary period, working with people to find out how things are done and all of that. Then after, when I'm okay that okay, yes, I can work alone, then I'll say it's that I can now work alone, then I will be accountable for my own action and all of that. During this period as well, not that you are not accountable to your action, no, you have your pain, so you have to, do what is right. Anything that you don't know how to do, you have to tell them that yes, I don't know how to do this. Can you do it? Let me see it, then I'll go ahead to do it. So that is it. So that is it about the preceptorship program. So that is what you should be expecting when you're coming from, a country, Nigeria, Ghana, African country, or anywhere to the UK. You either go to the ward straight, or you be supported by your trust for your OSCE. After your OSCE, you definitely going to the ward. And during that period as well, you'll be attending a lot of trainings. Yes, they have a lot of trainings, and you can always, they have department for each training, so you can always go to them. You can only do all of those things when it's expected of you to do it. Then after you get your pin, before you get your pin, but you've passed your OSCE, you start your pre-register practitioner period. Then after that, you get your pin, you now start your preceptorship program. And during your preceptorship program, each time you go to new ward, you should be placed on supernumerary period. And that's a period where you are not working alone, you're working with someone, and this person is going to show you everything about that ward. Please, 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 please make sure you do your supernumerary program period in each ward before you start working alone. Otherwise, you just be like, you don't really know how things is done in that ward, because different ward actually do things differently. They have their own manager. The manager have the way, he or she orientates people to the ward and all of that. So you need to have that period. So if you are sent to a ward and you don't have that period of supernumerary, talk to your manager, tell them that you need a supernumerary period, even if it's 1 week, but you should be entitled like 2 weeks. So if you need an extension, let them know. And if you are okay with 1 week, let them know. But you should do that supernumerary period because you obviously don't know how things are done in that world. So you need to be orientated to that world during that preceptorship program period. So I wish you all the best in your new role or in your new post. If you have any more questions about preceptorship program, then you can put it under this comment section and I'm going to reply you. And don't forget that this this is just an overview of the program. Different trusts have different way they do it. And obviously, because most trusts are just starting to recruit midwives, so you may be the first set in your, in your trust as an international midwife. They don't really know, they don't really have, a program yet. So they might just don't really know how to do. They are just trying to figure things out and all of that. And they proceed to a ward. They did not put you in supernumerary for some time. So you just need to talk to them, tell them that you need a supernumerary period because you don't really know how things are done in that ward. Even if you are working another ward for 3 months, 1 month, 4 months, this is still a new ward, a new placement. You need a supernumerary period, even if it's just 2 weeks for you to get yourself accompanied to what they are doing in that world. So I wish you all the best in your new role. If you like this, if you watched to this end, basically you like this video. So don't forget to keep it like, click that like button so that YouTube will recommend my videos to people looking for this information. Please. And don't forget to subscribe to my channel. Thank you. Love you. See you in my next video. Bye.